morning and welcome to Joy News Interactive. We're live on DSTV channel 41 and GoTo channel 144 on Facebook, Twitter and Instagram. We're Joy News on TV. My name is Mabita Sibidi and we have such an exciting show coming up, so stick and stay. We'll be back after this. Thank you so much for watching. Now, something that's been trending on social media is what the Highways and Roads Minister said about building 120 bridges. Now, let's watch that.
To do between 2021 and 2024, 11,000 kilometers of road, out of which we are convinced and we are hopeful and we are confident that 6,000 would have seen total completion and the remaining 4,000 would have been at different stages of completion, some of them substantial completion by 2024. This is the program for the road sector that has been put forward by His Excellency Nana Addo Dankwa's government. And let me remind you that between 2017 and 2020, we had done and completed 4,000 kilometers of road. If you come to bridges, we have programmed 200 bridges across the nation, and we have the statistics for each one of them. We have their age portfolios, we have their lengths, their width, and we know what is supposed to be done in each of these 200 bridges. We have tasked ourselves to complete at least minimum 120 out of these 200 by 2024. By the end of his second term, 20 interchanges in our country would have been built. We have estimated 25, but we are convinced and we are sure and we know what we are about because we have programmed whatever we are doing. 20 interchanges. And members of the press, mark me down. Say by 2024, 20 interchanges are likely to have been fully completed.
All right, so you've been reacting to this. Let's go to Facebook and see what you had to say. Joy News on TV. So the Minister of Roads and Highways has revealed that President Akufo-Addo was on the verge of weeping when he traveled on the Hamley Road in the Upper West region some time ago. Let me get some of your reactions on that. Nana first says he should travel on the BR West roads as well in the Western North region. Yableo. Nana Kwabena says, what? I bet those were crocodile tears and not real honest tears. This hypocrisy exhibited by our leaders is getting too much. Let's see what Alhaji has to say. After 4 years in government, you see how God is punishing you people. You're exposing the incompetence of President Akufo-Addo and his government. Ebenezer Anna says, please let him do a lot more traveling. A weeping generates generates road works, okay? And Peter says, were those roads not there when he decided to fix the Chebi roads? You guys should keep on clapping for him. Bertha says, it's all be joke. Marvelous Messi says, always telling lies. And let me see what David has to say. Don't come and pretend. Is this his first time traveling on Ghana roads? Somalia says, then he will collapse when he tries the Lambusi road. Okay, Michael says, man, be serious. And Matilda says, cry Ghana, a Galamsey polluted river. Away from that, the outbreak of the COVID-19 pandemic greatly affected health systems worldwide, and Ghana was not spared. The worst hit was elective surgeries at the peak of the pandemic, when government had to mobilize all resources to manage and curb the spread of the virus in Ghana, and also impose restrictions on movement in some areas. Unfortunately, fistula surgeries fall under this category, so patients who had been waiting for years to undergo the life-changing surgery had to be put on hold. These patients, who leak urine, feces, or in some cases both, had their plight worsened as a result of the delay in surgery. They continued to live in misery, isolation, and suffered stigma. And today on the show, we'll be having a conversation with the people who know and appreciate the condition of these fistula victims. They will share with us some of the challenges they encountered in 2020 and also the progress made so far in terms of the surgeries with the easing of restrictions. Is there still a huge backlog of cases to operate on? What is the strategy this year? And also, what has been the assessment of the National Fistula Task Force team? But before we begin the conversation, let's watch a report filed by my colleague Beryl Ernestina Richter.
According to the Ghana Health Service, even though this condition prevails in all the regions of Ghana, the northern region has the highest prevalence. She has been battered by poverty over the past years, and the COVID-19 pandemic has exacerbated her plight. Few minutes into my interview with her, Niwoluga started leaking. Rahinatu Isahaku is a senior nursing officer at the Buya Health Center in the Bandai district. She has been mobilizing women for fistula surgeries for more than 10 years. In December 2019, she was able to facilitate the transportation of Niwoluga and other fistula patients in the Bandai district for assessment at the Tamale Teaching Hospital in the northern region of Ghana.
It's a condition that they know themselves. So if they see that they are all suffering of the same condition and see one to be repaired, they try to find out how did you get the solution to your problem. Then that fellow is referred to come and see me. And if the fellow comes, I also try as much as possible to let them get a solution to their problems. It wasn't easy because the last time I sent them was when the Czech Republicans were coming to do some free surgery in Tamale. That was in December. So they all came with the help of one Mr. Edie. Sent them, we bused them to Tamale. And when they got to Tamale, they only assessed them and said they should come back and they will repair it after the new year. So I was preparing them to come for the surgery after the new year, only for this corona to pop in. So I personally visit them.
Now, joining me for this conversation is Dr. Justice Osei, and he's an obstetrician, gynecologist, fistula surgeon, and also a medical director for the Mercy Women's Catholic Hospital in Mankesim. Doctor, good morning. All right, let's see if we can get Doctor again. Doctor, if you can hear me, good morning. All right, so we're trying to reach Dr. Justice Osei to talk about this report, to talk at the back of this report that we just played, report about fistula. So, you know, the theme for 2021 was women's rights are human rights, end fistula now. But it seems like we're having a bit of a problem with Dr. joining us via Zoom. If not, then we will call him via phone. Okay, Doctor, if you can hear me, good morning.
Yes, I can hear you. Good morning.
Good morning. All right, thank you for joining us. Now, we all know how 2020 was a very tough year, particularly for health workers like you. All right. Now, in terms, in terms of elective surgeries, which unfortunately fistula surgeries fall under, briefly explain to us how the COVID-19 pandemic affected these surgeries in Ghana, especially during the beginning of the outbreak.
Yes. So, good morning once again. In the last year, we were supposed to do about 80 cases, but then we were able to do only 36 cases. And even if you look at that number, it means that we're able to achieve quite a good success, because looking at how the pandemic affected elective cases, it made it very, very difficult for even the bigger hospitals to achieve their targets. Yes, so at the beginning of the year, we're able to do quite a number. That's just before COVID came. We're able to do almost 20 in January, February. But then when COVID came and then the lockdown came, all elective surgeries have to be put on hold for some time. And that greatly affected the target that we had set for ourselves for the year. So yes, last year, the COVID-19 pandemic had a great impact on our work.
Okay, so what was the target for 2020?
So last year at our facility, we wanted to repair about 100 fistula cases. That's what we set out to do at the beginning of the year. Normally we do it like every quarter, so let's say about 25 every quarter. So in the first 2 months, January, February, we're able to do about 20 cases. That time, COVID has not hit Ghana. So when COVID came, that was from March onwards. That one greatly affected our activities, and then have to hold on with the elective cases towards the end of the year that we started doing that one. We were not doing it in large numbers, but because of the pandemic, we're just doing it in bits and pieces.
All right, so it's a new year and slowly restrictions are easing. How many have you done in the year 2021?
So this year we've been able to do 16 cases so far, and we want to try as much as possible to do it, as I said earlier on. At the earlier stages, we used to do maybe about 20 cases at a go, but we want to stagger it and do, let's say, 5 cases at shorter intervals so that we'll be able to do quite a number by the end of the year. Because of the pandemic, we don't want to bring a lot of people together at one place for fistula surgery. So now we are doing the elective, but we are also maintaining all the preventive protocols for COVID-19 so that at the end of the day, it will also not lead to the spread of COVID among the patients that we attend to.
All right, now let's talk about funds. In terms of funds, we know that the cost of the surgery is, covered under the National Health Insurance, but there are other costs associated before and post-surgery for these patients. So how does your facility take care of these expenses? Because we know most of, the patients don't have the actual funds. So what does your facility do to help them?
So we have a peculiar financing model for our patients in that we solicit for funds from benevolent Ghanaians, individuals, corporate organizations, and then we have the surgery for them at no cost to the patients. As you said earlier on, most of these patients are from low socioeconomic background and they cannot afford the cost that comes with the surgery. It's not only just the surgery, but the pre-operative preparation and then also post-operative preparation, including even minute details as to the foods that they will eat, their nutrition, all contribute to the success of the surgery. So we solicit for funds and then we carry out the surgeries for those who are affected with the condition. Luckily for us, last year, Access Bank and then some other organizations were able to assist us to do a chunk of the cases that we did. This year, we are also looking forward to sponsorship from these organizations and other benevolent individuals and Ghanaians who will come to our aid so that we'll be able to cure women who are living with this unfortunate condition and help to bring an end to fistula that globally we all want to achieve. Yeah.
So obviously, because last year you couldn't, operate as many people as you wanted to, there is probably a backlog of some sort. How are you trying to, ease up on the backlog? What are your plans with the backlog?
So as I said earlier on, we want to do it, let's say, maybe every 2-3 weeks, then we'll do 5. So the backlog is quite a lot. So we want to do it in pieces so that we don't bring all of them together. Okay. So that by the end of the year, you will be able to operate on, if you add all the total number that we will do by the end of the year, we'll be able to achieve a greater number.
Oh, okay. So how can one support these patients? Is there like any account or fund set up by the task force team?
Yes, so there is a Fistula account that has been set at Access Bank, and then also the task force has also set up a Fistula account to help with those who want to make contributions towards these surgeries. And then also we can also give our number out. So in case somebody wants to contact us, you can contact us and then we can help to bring relief to women who are living with these unfortunate conditions. Not only to support, but also patients who want to come and seek treatment. If you have a condition, you are constantly leaking urine or feces from your private part, and you want to know whether it is a fistula or not, you can call us and then we will make arrangements for you to come and then see us. And as I said, most of the time we carry out these activities for free. So I'll just give out my number.
Sure.
If anybody wants to contact us, you can contact me on this number 0244 864501. I repeat 0244 864501. So we are looking forward to individuals who want to sponsor patients with obstetric fistula, or even if you are a patient yourself and you want to come and then seek treatment, you can call the number that I mentioned, and then all of us will be able to work together to achieve our aim of ending obstetric fistula by the year 2030.
All right, thank you so much. That was Dr. Justice Osei. I really appreciate your time, Doc. You're welcome back from that breather. Now let's check out some Twitter trends from around the world. We'll start with Uganda and see what is happening there. All right, so Kololo is happening. Second is Chief Justice President Museveni is also trending. We also have hashtag 11th Parliament starts, and we know that Parliament was reading the names of all MPs to establish their presence ahead of the voting. So a total number of 320 MPs were in the House, according to the clerk to Parliament. This means 209 MPs are absent on the first sitting as the 11th Parliament starts. So that is in Uganda. Let's go to Nigeria and see. We have Abuja trending, Lagos is trending, we've got Mercy Eke who's also trending, and hashtag Ronaldo trending. And back here in Ghana, let's see what's trending. Hashtag release the 21. John Mahama built it. Nanado is also trending. KNUST is trending. Lagos is trending. All right, so those are some of the Twitter trends from around the world. We had Uganda, Nigeria, and back here home, Ghana. My name is Mapita CBD. This is Joy News Interactive, and this is where I draw the curtains on the show. Thank you so much for joining us. You know how to continue the conversation on Facebook, Twitter, and Instagram. We're Joy News on TV.